Yes, thank you so much, everyone, for yet again an overwhelming response for another webinar from the Ability series. Today, we'll be talking about importance of early intervention with Dr. Neeta Mehta. She's an autism interventionist and a remedial educator. I'm sure you will get to learn a lot from her, but more about her a little later. Let me tell you a little bit about Ability. For us as an organization, all carers of children with special needs, that is, special educators, teachers, therapists, and of course, parents. All of you are at the center of our universe. Every child wants to thrive, and every child should be given the opportunity to thrive. And our mission is just to make that happen. Our mission is to make things easier for you all, make things easier for all the caregivers of children with special needs. And one way we have been able to do that is through technology. But we truly understand that while technology could help a lot, without the caregivers, technology alone is insufficient. After all, it is only a support system, like there are other support systems, such as resources, community members, fellow members can help a lot, right? No one should have to do this alone. And that's what Ability brings to you. We bring to you host of resources and help from the community members to enable the best chance of discovering your child's true potential. One way we bring to you these resources is through our YouTube channel, which has over hundreds of useful videos from different experts. So, if you are a special educator or a parent who's seeking help for your special child, do visit and subscribe to the YouTube channel. We are pretty sure that you will find tons of useful information there. The link to our YouTube channel is being shared in the chat box by our team members right now. So you might want to go and check it out. Apart from that, also thousands of people are following our Facebook page. The numbers are constantly increasing, if you know. And with these numbers, I think so you would want to join them as well in following the Facebook page so that you can stay updated with all our upcoming events and our offerings in terms of resources and other tools to help the caregivers of children with special needs. So, this is something new that we have recently introduced, and we have received positive feedback from a lot of community members. If you haven't yet created an account on the Ability platform, we recommend you to do it because this is a place where you will find all the relevant events and resources in one place together. When I say events, I mean all the webinars and workshops that Ability is planning in the upcoming future, and also all the webinars and workshops that we have conducted in the past. This is the place where you can check all of them out together. What you need to do if you want to register for the webinar, visit that page. This is the link that we usually share. And if you're registering for the first time only, you will need to enter all these details in these respective fields. When it says create your password, you can choose an easy password, which is easy for you to remember. This password will be used later in the future for you to log into your Ability account. So you can use your email ID along with your password to simply log into your Ability account. And once you are logged in, for all the future upcoming webinars, you can register for any of the webinar or any of the workshop just by clicking on this button visible here. So if you haven't do you realize how easy it will get for you if you create an account on the Ability platform? If you haven't done that yet, we definitely recommend you to try it. And we know for sure that you will love the experience because there are many more exciting things that we are going to introduce soon in this very platform. So do check it out. Okay, now coming to our event for the day. Today's webinar would be hosted and conducted by Dr. Neeta Mehta. She's an autism interventionist and a remedial educator. Her mission is to create an inclusive society for children with special needs. She's also a pediatric physiotherapist and a handwriting without tears expert with rich experience of over 18 years. My goodness, 18 years seems quite a lot. She's also the director of Sahas Physiotherapy and Wellness Center. We are very happy to have you here with us, Dr. Neeta. Thank you so much for joining us today. Okay, so looks like there's some connection difficulty with Dr. Neeta. Dr. Neeta, can you hear us? Yeah. So, like I was saying, she has over 18 years of experience, and we are truly grateful to have her here with us. She has been kind and grateful enough to take out time from her very busy schedule so as to share experience and learnings from her years of experience with you all today. And there she is, our speaker for the day. So, without any further ado, I would request her to take over. Over to you, Dr. Neeta.
Good evening, Ms. Swati. Thank you very much, Ms. Swati, Mr. Balaji, and the Ability team for this opportunity to present this webinar. My internet connection is slightly unstable, so please bear with me in case I get frozen in between. But and good evening to all the participants. So let's discuss about today's topic. So I'll just start screen sharing. Okay, so our agenda for today is we are discussing about importance of early intervention. So we need to know first what is early intervention. So, and how detection for early intervention takes place by different stakeholders, say the doctors who are the pediatricians, your family doctors, neurologists, developmental pediatricians, therapists, including physiotherapists, speech therapists, occupational therapists, teachers, special educators, remedial educators, and most important, the parents themselves. We are going to discuss soft science for common challenges, importance of early intervention, and common early intervention techniques. So let's move forward. So what is early intervention? Now, every child grows at a certain pace, which may be different from each other, but more or less research suggests that there are certain developmental milestones that are achieved at certain ages, and it is between about 3 months time is given between a milestone being achieved. For example, if one child is walking at 12 months of age and another child is walking at 15 months of age, it is fine. It is considered okay and within the neurotypical scenario. But say if the child's walking is delayed by 2 years, the child is not walking even when he's 2 years of old, then that is definitely a red flag and a warning sign. So it is an example. So delayed milestones or milestones not occurring according to what the research has suggested as the standard. So then they point out to children who may be at risk of disability or challenges in the future. So providing treatments for the same. Picking up these risk factors early on and providing treatment which may include medications given by medical doctors, therapy given by physiotherapists, occupational therapists, speech therapists, and special education provided for academic needs and behavior modification strategies. So it is for children who are at risk of developing gross and fine motor delays, speech delays, social impairments, academic difficulties, and motor difficulties. It is for children who are at risk of developmental delays, as I mentioned. The prenatal, perinatal, and the postnatal factors are important indicators for risk development. How has a mother's health been throughout the pregnancy? How after the birth of the baby, what were the factors that were important? Was there any NICU stay? Was there jaundice? Was there any systemic issues that were there? Are there any hereditary factors that are coming in the play? Most of these are checked by the doctors, the gynecologists, the pediatricians over there. So they do consider all these risks and accordingly suggest tests. Risk factors can be noticed as early as 3 months. Risk factors can be detected by medical professionals, therapists, teachers, and parents working with the child. So just in short about the risk factors, if they are premature births, if the baby is born less than 37 weeks, full term being 40 weeks, if there have been infections during the pregnancy stage for the mother, or if there is infection in the baby post birth, if the birth weight of the baby is less than 2 kgs, then it is one of the factor of intrauterine growth retardation. And then there are hereditary factors, chromosomal factors, genetic factors, and other factors like orthopedic or neurological factors. So all of these are certain risk factors, and ICU stay also indicate a risk factor. Okay. Now, when we talk about assessment, so what is it that as doctors, as therapists, what are the things that we assess? So detection by medical doctors can occur in a room when you are going for vaccination, or when you are going for the first checkup post birth, or in the future when the child is even 1 years of age. The pediatricians do keep a watch. They will take the size of the head, that is the head circumference, because as the child is growing, the brain is also growing, and the circumference of the head grows to accommodate the growing brain. When the brain does not grow properly, then you may see that the child has a small head. It is called microcephaly. If the head circumference is too huge from the standard that is being decided, 2 points more or 2 points less, then it does indicate a risk factor. Body weight, if the body weight is not growing according to the developmental factor, and there is not a smooth graph for the weight, then it is an area of concern. That is failure to thrive. The doctors check the alignment of the palate, then they check the fontanelle, that is the anterior part of the head, the positioning of the limbs, whether the limbs are tight, limbs are okay, if there is movement in the limbs, that is all right. They check the posture of the baby, they check reflexes, they check if there is any systemic issues, that is gastrointestinal issue or any kidney related issues. If hearing is normal, if vision is normal, they check how the child is interacting with with the parents, with the caretaker, check the arousal and the alertness of the child, and also do inquire about the developmental milestones, that how it is going, even the speech they consider. When the child is referred to a therapist, if there is a risk factor, or if the child happens to be seen by the therapist, what is it that the therapists also have a look at? Definitely they also look at head circumference, because they want to know the position of the head, whether there is microcephaly, that is a small head which is not so the brain development has not taken place well, and therefore there is microcephaly, whether there is swelling, the weight of the child, if there is failure to thrive, positioning of the limbs, if there is any tightness of the muscles, or if there is low tone, that is weightlessness in the limbs when the therapist is feeling it. They check reflexes, if they are more elevated or less. They definitely check gait, if the child is already walking or even cruising. So what is the posture of the child while the child is cruising, while the child is walking? Postures in different positions like rolling, sitting, then standing. Sensory systems, they check the attention of the child, they check the regulation of the child, how the child is regulating in the environment, whether the child is cranky most of the times, or is he able to settle down? Is there registration of the environment, of the people around him? How is the child reacting to the new stimuli that is occurring around him? What is the attention span of the child? They check the visual systems, the auditory systems, the tactile, proprioceptive, vestibular, gustatory. So basically, they check, not they check direct vision, which is checked by eye specialists, but they check what are the certain perceptions that are seen by the eye, that is eye-hand coordination, figure ground, that is, picking up things in a cluster of things, choosing a thing to pick up, or removing shoes in a shoe cupboard. That is like when there are a lot of things and you can choose a thing and get it out. That is an example of figure ground. Auditory, whether the child is able to listen to, is if the child's hearing is all right, is the child actually paying attention to when you're calling him out? Is he able to understand the instructions that you're giving him? Is he able to understand multi-step instructions? Tactile is the touch system. Proprioceptive is the joint sense, knowing where your body is in space, how my hands are moving right now in front of the screen, how my hands are moving on the side. All this information is through my proprioceptive system. And then is your balance system, which is in the middle ear, and which is majorly responsible for how your arousal is, how your attention span is. And gustatory is your taste system. They check if there are any speech delays, whether the speech has moved developmentally in the correct direction, or there is a major delay as compared to the chronological age. Communication skills, how is the child picking up instructions? If even if the child is non-verbal, is the child able to receive and follow instructions? Is the child able to express his needs? And language development, how much the child can use his words or make out words. And then there is detection by the teachers, which is very important, because most of the children come to the therapy setup or to the pediatricians or to the neurologists when there are difficulties detected in school. Before that, these difficulties are not really paid attention to majorly. So the larger population thinks that the child will carry on and move, but when they go to school, it is the teachers who can see that there is something amiss. So whenever this is one indication, when teachers, you find something puzzling with the child's behavior or the child's movements, or the way the child is paying attention academically and faring academically. So you seem to think that the child is very cute and sweet and he's talking very nicely, but most of the times the talk is irrelevant and there is no connection to the talk. So it might seem very puzzling to you. The child is very cooperative, but most of the times he's making mistakes in reading and spelling, is not able to grasp his math. So these are certain pointers that what is happening. So majorly I would like to tell the teachers is you should avoid labeling at that time, because many a times when we feel that the child is not doing things, we may just say the child is lazy, or he's sloppy, he's not paying attention, he's immature, and now I would like to talk to the parent. So the thing is, if we do away with these labels and try to find out that why is it that the child is finding it difficult or avoiding this task, or is not being able to do this task or finding it challenging. So instead of labeling, if we do that, we may actually be able to sit with the parent and sit with a checklist and guide the parent for further testing. So the detection by teachers will definitely be there in reading and writing difficulties, in ability to follow instructions. Like for very young children in preschool, what you see is after the settling period is over, after they have come to school and after the settling period is over, for most of the students 2 months have passed, yet by the third month the child is not able to settle, not able to stay without their familiar adults. If the child is moving away from circle time and moving on his own, climbing on furniture and playing by his own, preferring solitary play, not interacting with peers, these are certain indicators that somewhere the child is not following instructions and he's into his own world. So ability to follow instructions, peer interactions, how the child is also playing with his friends becomes important, is seen by the teachers, because that is the first environment the child comes to in a play school and he finds so many children. How is the child able to regulate if he's not getting a certain thing that he wants, or if he's not happy with how things are? How is it that he cranky most of the time? Is he crying for hours and hours, or is he able to settle down when he's being spoken to? So how is the regulation level of the child? If the teacher can notice any atypical behaviors, in the sense that when you see a child who is on the spectrum, they usually prefer certain toys or certain materials, and they may play with those materials or toys for hours and hours, which may seem a little out of line, because when you compare it to your peers, you play for some time and then you move away. But if you get obsessed with that toy, or you get fixed with a particular routine, that may signify some atypical behaviors. To give you an example, one of my child used to play with the slice of vegetable. So he used to put it in front of his face and keep moving the slice, a cucumber slice continuously, and he used to be very happy with that. So that's a form of self stimulation, but also a form of a atypical behavior. Detection by parents, very, very, very important. And here, I would say that whenever parents feel that something, there is something innate, when they feel that something is out of place, where my child's development is concerned, even if it may not be so, it would be great if you could find out whether your doubt is right or no, because most of the times, that innate feeling is right. Delayed milestones, they also see the delayed milestones as compared to their previous child, that is their own child or of a relative. uh, they may see that the child is not able to communicate his needs appropriately, not following instructions, gets disinterested very soon. So many times parents come to me and say that he does not even sit in one place, he just wants to move around all the time, he will just play with one toy, but that also he keeps throwing. The play is in the form of throwing, and he keeps throwing with the toy, and he enjoys that kind of an action. He does not play appropriately. He puts the toy the way it is and then moves on to the other toy. He needs new toys every day. Breaking may also be there. Parents may indicate a challenge, but they may not be overly concerned. And that's where I say that even if you feel that there is a challenge, it is better to find out before than to find out later. History taking would be very important in this, for teachers, for therapists, for doctors, whether if any hereditary factor is there, and counseling may be necessary. So as I mentioned, labeling first. So when we actually have a doubt about the risk factor, it is not necessary that they are going to be labeled, because formal assessments take place at much later age, at around 6 years, 7 years. The child who may be coming to you at preschool may be at 2 years, at 3 years, at 4 years. That time, what is necessary is to recognize that yes, there is a challenge which may put that child at risk of learning difficulties, learning disabilities, autism, ADHD. So even though formal assessments have not been done, it is necessary to introduce checklists at that time, and to sit with that checklist along. If the therapist is conducting it, therapists usually visit the preschool or the environment the child is in, observe the child, take a parent interview, take a teacher interview, and then guide the parent further for assessment. Similarly, the teachers can also use these checklists and guide the parent that where all the child is missing out on the particular milestone. But definitely labeling of laziness, sloppiness, immature, or stubborn is something that should be avoided, because at an early age the child is actually very open to learning, and if he is not able to learn, that is the time when there may be certain behaviors that you would see. So you really need to find out why this is happening. So there may be some soft signs indicating learning challenges. Many of my parents who come to me, they say that the teacher has said that he's very clumsy. He keeps dropping things, he keeps dropping his pencil while sitting on his bench, either his eraser. He forgets the instruction that I have given to him. He forgets to copy from the board. He seems very lazy and sedentary. The child may have low tone, seem very weightless, and he may indulge in play while sitting and not really want to move or be active or go into the garden. On the flip side, there may be children who actually enjoy a lot of activity and do not know when to stop. Difficulty following multiple instructions may be there. The teacher may have given out instructions like, you can keep your shoes there, put your bag in your cubby hole, take the book out and come on the bench, where all the instruction may be lost, or only the last instruction may be with him, and the child may actually be confused about it. If there are any coordination and balance issues, if there are frequent falls throughout the day, it is of concern. In spite of saying, teaching right and left, or at an age where they should know it, there may be difficulty with right and left discrimination. There may be reading and writing difficulties, difficulties in math, sensory perceptual issues, may be there, which may be affecting any of the systems and would require an in-depth assessment. Peer interactions may not always be nice. So maybe if the child wants to be a part of the group, is trying to be a part of the group, he's trying to communicate, but perhaps if logic is lost out on him, he may not know what to say appropriate at that time, so he may be actually bullied or he may be laughed at, and he may not be actually made a part of the group. So you could also see that the child may want to avoid school. You may see grades which are consistently low, and the child may actually avoid moving out and approaching friends, also at an age where the child can do that. Signs indicating autism spectrum, definitely there is a DSM-5 scale which puts in detail of how autism spectrum is diagnosed and for how long the symptoms have to be there. But just so that in a preschool level, what you can see is, there's lack of joint attention. Say that you are teaching the class, the whole class is looking at you, you're teaching a class about some toy or some activity, and both the teacher and the children are engaged in that activity, but the child on the spectrum may not pay attention to the activity at hand and may be involved in solitary play of his own. So there is lack of joint attention, lack of engagement. There may be imitation skills may be very poor, since children learn through imitation, through how what their adults are doing, how their environment is, they pick up through imitation. You may see that imitation skills don't come very well always to the child on the spectrum. The child may be in a world of his own, that is, as I said, solitary play. There may be impaired receptive or expressive language. So, where the teacher or the parent is giving out instruction, they know that the child's hearing is all right, but the child is actually not receiving any instruction till the teacher or the parent goes in front of the child and gestures or talks to him about it. Expressive, the child may not express his need of water or food, basic needs as well sometimes, or he may use gestures or hand holding to express his need. The child may be verbal or non-verbal, and the child may be having sensory issues which may be at many systems. So I will go to the sensory issues separately also. Signs indicating attention difficulties is inability to sit at one place. There is hyperactivity. The child keeps moving around, climbing on different furnitures, even to the point where we feel that it is dangerous and the child may have a fall or child may hurt himself, but the child does not seem to understand that this may be dangerous for him. There may be some rocking movements while sitting. There may be jumping from one activity to another. There are also certain children, and you may see this in girls also, though ADHD common in boys more than girls, but in girls also you may see this. There is lack of sustained attention. So maybe if you don't see
Hi,
hyperactivity,
Dr. Neeta.
yes.
So sorry to interrupt you. Some of our participants are listening the background noises, and probably that is interfering with what you are saying. I was just wondering if we could solve this issue in some way.
Okay. So actually, as I informed you that there is some construction going on around in the area. So
Right, right.
I'll
So
be
maybe you
loud.
could try being a little
I'll be
louder so
loud.
that people can hear you clearly. Thank you so much for the cooperation.
I'm
Yeah.
so sorry for the trouble. Okay. Fine. So I'm going to be loud. Okay. So what are the signs indicating attention difficulties? Inability to sit at one place for a longer time, hyperactivity, rocking while sitting, jumping from one activity to another, lack of sustained attention during the activity. So what happens is the child may seem attending to the activity, but as your attention shifted to the sound also that was in the background, that way the child's attention may shift to what is occurring in the background, and that may happen consistently. So the attention on the task may not be for a long time. You may also have notice poor fine motor skills. The child may not know how to hold a pencil, how to open a water bottle, how to open his own box. Sometimes may not even be able to eat on his own. There may be sensory issues. Um, then there are signs indicating sensory issues are What is, first of all, sensory systems? As I described, there's a touch system, balance system, your oral, that is around your mouth, uh, the visual system, the auditory system, your taste, and your proprioceptive or kinesthetic system. When there is hypersensitivity or hyposensitivity in any of these systems, or if there are registration difficulties in these systems, then you may see a sensory difficulty. uh, Miss Swati, do you want me to actually move from this area to another area? Or do you want me to stop sharing for a bit so that the sound becomes less?
Yeah, I think so. Our participants would be cooperative and kind enough to wait for 1 minute
Okay.
till you change the location.
Yeah.
Thank you so much, Dr. Neeta.
Yeah. Yeah.
Yeah, maybe you could turn your video and
Yeah.
audio. So Dr. Neeta will be back shortly. As I could see from the chat box, some of you are facing some difficulty. So we would like to ensure that there's no difficulty in hearing what Dr. Neeta is sharing, because she, of course, is sharing from her years of experience and there's valuable information out there. We will also be sharing the recording of this session along with the slide deck, like we always do, in your inbox. So the ones who are asking doubts about that, stay rest assured, you will receive an email and where you could access the slide deck and also the recordings of this session and all the previous sessions also, all the past webinars also, if you create an account on the Ability platform. Our next webinar from Ability is scheduled for 10th of March. This is will be about cerebral palsy, and a very experienced doctor, Dr. Neelam Sodhi from Singapore, would be conducting this session. So if you would like to learn more about it, please visit the link that would be shared in the chat box shortly. Meanwhile, while Dr. Neeta is coming back and she would be taking a minute or so to resume the session, you can go check this link out and register your interest definitely for this session. I'm sure that there will be very valuable information for the special educators and therapists also in this session. And I feel, I was just going through the chat window, if someone is asking if I could see the recording once or many times, yes, you can see the recording as many times as much you want. You will receive, all of you who are attending the session live will receive a certificate in your email ID as a certificate to certify your participation in the event. And yes, you can set up your account using app.ability.com. Our team member has just shared the link in the chat box. And if you face any difficulty, do write to us on support@ability.com. And Dr. Neeta have changed her location. So now hopefully there'll be no disturbances. Over to you, Dr. Neeta. You might want to resume the screen sharing again.
Thank you. Thank you so much. Okay. Okay. So sorry for that disturbance, but now let's take it from here. I was talking about hypersensitivity or hyposensitivity or registration difficulties in one or more of the sensory systems. So let me give you an example of the touch system. When a child who has sensory issues or touch processing issues may be defensive, so tactile defensive, may not like to be touched. If you touch that child, the child may actually touch himself again on that area, move away, or may have some tantrums or meltdowns because he has been touched. Taking in a new environment or taking in new people may be difficult for this child because it is very discomforting to the child and his touch system. On the flip side is the tactile seeking behaviors that you see in some children, where the child wants to keep touching something soft or wants to carry a napkin everywhere the child goes, or a soft toy, because it is like a security to the child, plus that touch is giving some kind of sensation to the child which is keeping him safe or aroused. Vestibular system is when the child moves in different directions. There is hyperactivity, so doesn't know when to stop. As I said, like if he's on the swing will move on and doesn't know that it can be dangerous, or going up and down for hours and hours. That is seeking movement, versus a child who has low tone and actually may fear movement, or may fear climbing steps or descending steps as well. um, um, may fear rides that may be actually appropriate for his age. So on and so forth. In different sensory systems you see different issues, and that also can be seen in the classroom setting. Now, why early intervention? So we have neurons. You may see the structure of the neuron up on the slide. We have neurons in our brain which carry electrical and chemical signals to in our body. So they transmit signals from one neuron to the other neuron, which pass this information to our muscles, and that's how we do an activity. So when the child is 2 to 3 years of age, now where one neuron meets another neuron, it's called a synapse. When the child is about 2 to 3 years of age, lots of synapses develop in our brain, uh, which uh, which help us in a lot of activities. But the synapse that we don't use will get pruned or cut off. It is like use it or lose it. So if we are not stimulating a particular activity for a long time, that synapse is going to become weak. The activity which we do, that is going to become strong. As we say, practice makes you perfect. What does practice do? Practice makes these synaptic stations very activated, and therefore whatever you have learned stays in your subconscious and it becomes automatic in nature. So at 2 to 3 years of age, if we are doing early intervention, we are actually activating the synapses which allow for the child to reduce that difficulty, and also cut off those synapses which we do not want to come in the way. We don't want it to come in the way of the child. That is called synaptic pruning. Now there are several checklists out there which special educators, which teachers can go through and have an idea. There is MChat for ASD, Indian Scale of Autism. There is a sensory checklist and profile that therapists use to find out how much is the scale of the sensory issues. There is the ADHD scale which the psychologists use. It's called the Vanderbilt Assessment Scale, and they actually sit with the teachers, therapists, and by their observation and parent interview to find out a particular score on which the child has ADHD. Then there is a TIMP and the Alberta Infantile Scale for motor delay that is used by physiotherapists. And these are certain early intervention techniques which are used by speech therapists, child development specialists, physiotherapists, and occupational therapists, each having their own skill set. And depending upon what the child's age is, what is the dysfunction that the child is having, or what is the risk factor that the child is having, accordingly the child will receive that kind of intervention. It may be speech, it may be physio, it may be occupational, it may be special education, or it may be a combination of all. So that's why I say why early. So before I go to this, I would now actually want to say what happens when you do early intervention. So giving you an example of a child who had come to us at 3 years, at actually 2.5 years of age, was on the autism spectrum, is on the autism spectrum, had moderate, was on the moderate side, and had very limited verbal skills, and there were certain sounds that were coming up. With early joint attention and engagement was very less. So then we actually did the early intervention. We worked completely with the autism intervention program, working on attention skills, receptive language, expressive language, social and play, and sensory regulation. So when we do early intervention, so you saw what we achieved with the child was this child had come to us, and with the skill, this limited skills that I just mentioned, and we could achieve this the circle thing and the drawing thing, we could actually achieve this by the third session. The asking of nut came through by fifth session. So the sooner you intervene, the sooner you will get a positive outcome. Giving you an example of when the intervention doesn't take place early, what happens is the child has formed his own patterns of behavior. He has observed, he has learned how to get out from it or how to now move through it. And also, now as he grows forward, his self-esteem, his confidence skills are going to be affected, because now he doesn't know how to do it. He may actually shield that particular thing or move away from the activity, but innately his confidence and self-esteem skills would be affected. Secondly, it will also affect the mental health of the family, because you do not know how to now help this child. Giving you an example of when the teacher had certain concerns about a child, what the parents saw was they saw individual symptoms and they started working on individual symptoms. So if the child had, say, attention issues, he had low tone, he was moving from one place to another, he had difficulty in, say, uh, in peer interaction. So the parent would choose one particular goal, say for attention, and they would keep working on attention. But then the sensory issues would not be taken care of. The child was not seen as a whole. Whenever early intervention is done, the child is seen as a whole. His physical self is seen, his cognitive self is seen, his academic structure is seen, his adaptive skills are taken into consideration, behaviors are taken into consideration, and the child's program is made as a whole, and it is teamwork. So early intervention, the sooner it takes place, it is better, the outcome is much better. For a 7-year-old child on the spectrum who we were seeing, who had come with developed patterns of behavior, it was very difficult for him to enter the clinical setting. Uh, to to even enter from the waiting room to the actual room took us about 5 sessions. We also went through a period where the child threw things in the waiting room because he could not bear the environment and he just didn't want to be there. Even if a particular route changed while coming to the clinic, the mother could not um, control his aggressive behavior at that point of time. So sooner you intervene, it is better. So that's about early intervention. Thank you. And now I would be ready to take your questions. I'll stop share.
Thank you, Dr. Neeta. That was a very informative session indeed. Uh, the chat box is filled with messages of gratitude for you. So, like I was already informing our attendees, our next webinar on cerebral palsy is scheduled for 10th of March. This will be a story from a mother. An experienced doctor from Singapore will be conducting the session. You can find out more info about the title and the contents of the webinar in the chat box by visiting the link that our team members are sharing right now. So if you want to register for the webinar, you can do it right away and share with others who might benefit from this session. And now, without any further delay, let us move to the questions that we have received from the attendees. The first question, Dr. Neeta, is from Atiza. Atiza is saying that my 4 years old son was recently diagnosed with global developmental delay with autistic traits. Main concern was sensory integration with difficulty of emotional regulation, which contributed to the delay. She was recommended to enroll him in early intervention program, speech therapy, and occupational therapy. So her question is, does she need to enroll him for early intervention program if she takes speech therapy and occupational therapy? Because her understanding is that early intervention program is also a form of occupational therapy. So if you could suggest how to go about this particular diagnosis and also this situation.
Sure, sure. So, see, the child is 4 years of age, and if the child has been referred for early intervention, and you're saying there is global developmental delay, it is very good that occupational therapy and speech therapy has started, and it is a part of early intervention, yes. But at 4 years of age, you could also look at how, if there are any academic concerns, if there are any concerns, if the school teacher has informed you about it, you could also look at starting education, special education, remedial education if needed for him. Yeah, that's
Okay, the next one is from Jaya. Jaya Bharadwaj says the 7-year-old son is suffering from silent seizures. Ability to speak and, and consequently comprehension is affected because of these seizures. There are certain symptoms coinciding with autism, although the doctor has never used this term for the son. The doctor is very sure that he will be able to get a normal life like other kids once the gap is bridged. So Jaya is quite worried about him right now, and what is the useful training that she could incorporate so that if there's any precious time that does not get wasted. So what would be your advice, Dr. Neeta, to Jaya?
Yeah, so Ms. Jaya, since you mentioned that the child is already 7 years of age, so that means he has reached a stage where he would require a lot of interventions, and definitely what you mentioned as seizures, silent seizures, and that some developmental issues, they definitely need to be looked into. So the child will actually benefit if you can start therapies for him plus special education because he's already 7 years of age. But before that, you could go for assessments, which the therapist can conduct, which the neurologist will conduct, which your doctor may himself be a neurologist. But definitely, therapist and special education will play a role over here and will help the child further.
Sure. The next one is from Diksha. Diksha has a question about her brother. The brother is 2 years old. The brother was premature, so he has some strength issue in his legs. Although he can walk properly, but he's facing balancing issues. And also, he doesn't eat any solid food. Diksha and her parents have tried so much, so her concern is he only speaks mama, papa, didi, kaka, tata. Those are the only few words that the kid says. So is there any serious worry, or what should be the course of actions that Diksha and her parents should follow?
How old is the child, you said, Ms. Swati?
2 years old. 2 years old.
Sure. So, say at 2 years old, the child has not even achieved independent walking, and you are saying that the muscles are tight and which may be coming in the way and may be contributing to the motor delay. The speech is also delayed because the child is actually speaking in monosyllables. So definitely, and there are oromotor issues also, as you said, because the child is not is able to eat only a certain type of food and not another type of food at 2 years of age, which is definitely a delay and definitely suggests risk factors. So a very, very detailed assessment is necessary to help you and to help the child further. So definitely the contact has to be the neurologist or the developmental pediatrician, therapist, physiotherapist mainly for his balance and coordination issues, and speech therapist for his speech issues. And if there are any sensory issues, I'm sure that the therapist will pick it out and accordingly guide you further.
Right, right. The next question is from Fatima, who's watching us live on Zoom. Is there a particular type of difference between hypersensitivity and hyposensitivity? And if yes, what exactly is the difference?
Definitely, there is a difference between hypersensitivity and hyposensitivity. So, as I mentioned in the tactile system only or the touch system only, that you can observe that sometimes the child is very sensitive to touch and therefore defensive and moves away from being touched or being in a new environment or a new place where the child is going to feel very uncomfortable. So that is hypersensitivity towards the touch system. Hyposensitivity is where the child is not getting enough information about how his body is in space, how is the touch sensation, and he will keep seeking that sensation. So, therefore, he will keep touching. He may touch certain people to the point of irritation, or he may touch certain objects or seek certain objects for fulfilling that hyposensitivity. So that is a difference, and this exists in all sensory systems. And therefore, it is something that needs to be looked at and requires sensory integration therapy.
Right. Hope that answers your question. The next one is from Mari. Mari is also watching us live right now on the Zoom webinar, and she has sent her question via the chat box. Mari wanted to understand that after you have implemented the early intervention program, what will be the next steps? Can the child go to regular classroom after the early intervention program is over? And also, how long should the early intervention program run for? And wow, there are four questions in those same lines. So maybe you might want to answer one by one. The last one is for what age bracket in particular the early intervention would be more effective? So if I could just repeat, next steps after the early intervention, when can they start going to a regular school after the early intervention? How long should be the early intervention program be, and for what age bracket it should be? These are the four questions from
I'll go
Mari.
backwards. I'll go backwards. So the early intervention program starts as soon as you see there is any risk factor. So for I would say I would start even at 3 months of age with the baby who has limited imitation and joint interaction skills. From 3 months of age up to 5, 6 years of age, that is a period that you have to look at it as early intervention. After 6 years of age, you want the child to go into formal schooling. So your preschool years are major years for early intervention. Second, for how long does the early intervention take place? It depends completely upon the condition or the risk factor that the child is being looked for, the challenge that the child is being looked for. And then accordingly, if there are improvements, the child moves further. So for example, if a child is doing very well, attention skills are developing very well. So to tell you about this child only, whose video you have seen on the spectrum, this child actually goes to a school which is inclusive with a shadow teacher. So the further step was to send him with a shadow teacher after doing the early intervention program, and the program further continues according to what the child needs. If it is a child who has motor issues like cerebral palsy, then the intervention program continues for a longer time. It is not only early intervention, but by then you may have achieved certain major milestones which you would not have achieved if you would have started later on, or there would have been surgeries in place. So the early intervention program, how long it lasts, it totally depends upon what is the challenge that you are dealing with. That was the second question. The steps after early intervention is steps after early intervention is when you reach at an age where you can do formal testing, then you need to do a psychological testing. You need to connect with a psychologist or the person who does the test and clinical psychologist, so that you further get what is the difficulty level of the child and what is it that the child has issues with, so that you can speak with the school, you can speak with the teachers, you actually the parent would understand the difficulties the child is facing and accordingly help him further, having complete understanding of the issue. In the near future, if a shadow teacher is required in the school, then a shadow teacher is appointed along with the child, who stays with the child throughout the school day and helps him with his academic skills, with his behavioral skills, with his routines in schools and his co-curriculars. So I think that is 3 questions that I've answered, or I've answered all of them.
You have answered all of them.
Okay.
Great. Thank you so much, Dr. Neeta. Hope that answers your questions, Mari. Okay, the next one is from Agnes. Agnes is an educator, and what she's saying is the child has the manifestation of having difficulty in social and oral communication. The child is 4 years old, but the parents are in the denial stage. So, what is the probable intervention that can be implemented, because the parents are not likely to implement the interventions? So what she or any of the educator can do, being the educator, if the parents are in denial?
Yeah, so that is the major difficulty we all professionals do face. So, but bringing the parents on the same page is very, very important for the program to be successful or for it to help the child. So, first of all, the information that I have is where there is social difficulty and where there is oral difficulty. It is a little insufficient for me on how I would assess the child or if there are any additional difficulties. But say, considering that there is a difficulty and the child is already 4 years of age. So, what you could do is you could, instead of telling the parent directly what is the problem, you could actually conduct checklists with different caretakers of the child. So, with the parents, with other teachers of the child, then you can have a meeting with the parents and show them on the checklist that, see, these are the difficulties the child is facing as compared to his peers and where he's lagging developmentally, and what is the age group that he's working at. So if he's 4, the developmental skill at the social level may be 2. uh, if he is at the oral level, it may be still less. So therefore it is coming in the way of his learning, in the way of his progress, and therefore you could consider going for an assessment. Once the parent decides to go for an assessment, from there on, your pediatricians, your developmental pediatricians are able to take over and actually give them a diagnosis and make them understand better. But without the parent being in the team, we could do as much, we could take the maximum effort, but it may not always help. But doesn't mean that we don't have to. We do the best that we can, but we need to conduct checklists to show them that this is where the lag is there.
Sure. Conducting a checklist might help, and we can only pray and help the parents understand how and what kind of help does the child need. Since we are running short of time, I will take one last question for the day, which is from Evelyn. So Evelyn is saying, what kind of intervention do we need in distance learning, since the problem is also related to insufficient gadgets and unstable internet access for some of the students? So if we want to implement interventions via distance learning methodology, which a lot of people are facing these days due to the COVID situation, what would be your suggestions?
Okay. So yes, we also have faced a similar situation as a center, and me being a pediatric physiotherapist myself, on also I use how to develop the intervention plan. So there, the major stakeholder is the parent. Major, we need the help of the parent to conduct sessions online and to guide the parents to do the work with the child. So what we have done for children on the autism spectrum is where the child is unable to sit for a longer time in front of the screen and follow instructions and follow intervention plans. We actually have devised weekly plans for the parent, which the parent has to do at home and send us videos on which we keep giving feedback on what to change, what to add, what is it that can now help the child. If there are challenges, we move a step backwards. If there are progress, then we give another program for the next week. So, for example, a child on the autism spectrum who is 10 years old, who has not been to school since a year, who is missing his physical activity, but he loves baking. And so we said, and he loves basketball. So definitely we put the basket is definitely available in the market. It can be put at home on a window sill, and you can do physical exercises and physical activity with the child. At the same time, we put him towards baking, where the parent is actually doing instructional baking right from step 1 to step 6, step 7 till the cake is baked, and the reinforcer itself becomes the cake itself. So the child is very cooperative on that end, and he's actually doing the stuff, and his energy is also getting utilized in that direction. So we do a thorough parent interview, and accordingly we build a customized home program for each child. For a child who's able to take in my instructions, who is so I have a child who is non-verbal, who is not on the spectrum, who just has speech difficulty, but is very eager to learn. She sits throughout the session for 40 minutes, takes down the instructions and follows the instructions. So it depends from child to child. So I would use both methods on what is best for the child that I have.
Great. Thank you so much, Dr. Neeta, for your very valuable inputs, advice, and feedback to all the attendees of today's session. You have shared some useful advices and useful piece of information with everyone who has joined us for this session today. And we are really hopeful that this information will help them all. Since we are short of time, we have now reached to the end of session. Before I end the session, I would like to inform all the attendees and apologize because the last time I was mentioning about the upcoming webinar on 10th of March, I did say that the next webinar would be conducted by Dr. Neelam from Singapore. My sincere apologies. I misread the info shared. Actually, she is from Ludhiana, but she has led the development of the North India Cerebral Palsy Association and is also a board member of the National Trust for Persons with Autism, Cerebral Palsy, Intellectual Disabilities, and multiple disabilities in the Ministry of Social Justice and Empowerment, Government of India. So yeah, you do not want to miss this session. If you would like to register, please check out the link in the chat box right now and register for the session. So coming to the end of session, Dr. Neeta, how did you enjoy today's session? What has been your experience?
Oh, it's a great experience to connect with all the participants and answer these questions. Actually, understanding their perspective, where they come from, it is great. It was great to be here. I'm sorry for the glitches that happened from my end, but thank you very much for having me, Ability team and the participants.
No worries. I hope that the end result that was delivered was very useful for the participants, and our community and our attendees have been cooperative enough as long as they are learning new things. So thank you so much, dear audience, for being such a patient and cooperative audience. Some of you are asking for the feedback link. Yes, do share your feedback. Our team members have already shared the link for the feedback of today's session in the chat box. I will request each one of you to share your feedback about today's session. This will help us to improve the experience further in the upcoming future. Thank you so much, everyone, for joining. Thank you, Dr. Neeta, once again from the core of our heart to joining today's session. Looking forward to much more and many more learning sessions from you. Thank you so much.
Thank you so
See you
much.
all on the next webinar. Bye-bye.
Bye.